Yes, welcome back. You're still watching Power Breakfast right here on Citizen TV, and we continue with our news review. And you're looking at the biggest headline today, and it has to do with the health crisis. The doctors and nurses strike enters day 2 today. So far, crisis all over the country. People are dying. Some are committing suicide. Some are mentally ill. Patients have escaped from Mathare Hospital, and that's only day 1. And my question to my panelists is it possible to have a contingency plan by government as you anticipate a strike by doctors? Is it possible? Is it something that can happen? Let's start with you, Bwana Malo.
I think it depends. Yeah, it is possible if it's a caring and a planning government. First and foremost, I want to let you know that in this country, we still have a shortage of the medical personnel. So in terms of having plan B, it is actually not very realistic. As you mentioned earlier, when it comes to striking doctors, you can get a policeman to administer exams, whatever it is.
Yeah,
but when it comes to aspects of medical, you cannot get a policeman or whoever, because this is a field that needs a lot of training.
But we have military doctors, yeah?
Military doctors, we have a shortage. First and foremost, they can't even cope with the demand when it comes to the military. Maybe the issue of going to the final students at medical school, maybe that will have been an alternative. But still, even if you go to medical school and get these students, still we have got a shortage. The issue is this: the government is failing. Because this strike, they didn't wake up a day, they gave a notice. That's why they have said that they gave a notice of the strike. What was the government doing at that particular time when a notice was being given? And I said earlier, here is an issue about priorities. When it comes to matters of health, the difference is day and night. The difference is life and death. A responsible government should have given a priority in terms of discussing about these issues. Last time we had a crisis with pilots in KQ. The government moved in with speed, and they resolved the matter. And this is about traveling where you could delay. But here is about life and death. What is the government doing? That's why we are saying the government is being irresponsible. Yeah, they should move quickly, come together and see how can they strike a deal so that these doctors can get back. Again, you know, when you look at the CBA, every Kenyan has a right to an association. These doctors have an association for purposes of their welfare. There was a CBA. A CBA means you sat together, you agreed that this is part of your bargain, you're supposed to do this. By the end of the month, if Royal Media doesn't pay you a salary, how will you feel? The doctors in this country, they're not paid well. I can assure you. And a lot of this money which is supposed to be paying these doctors is going into wastages in terms of corruption. Look at the scandals we're having in this country. If at all we are going to manage this and limit this issue of corruption, there's enough money to pay the doctors. There's enough money to pay the teachers. But because of the problems of corruption, this money is going into wastages. And it's the responsibility of this government. Remember, President Kibaki used to say, a healthy nation is a working nation. If the nation is not healthy, it cannot be working. This issue is actually a crisis. And it's important that His Excellency the President, none other than His Excellency himself, must be on the front line to call these people, whether in State House, so that we can have a solution on what should be the way forward. And this should not be like tomorrow. It will be like yesterday. This is a big crisis. If Parliament was in session, I was going to move a motion of adjournment to discuss this crisis. We can't afford to lose Kenyans anymore.
But Njogu Barua, of course, if we draw parallels with the education, what's happening in the education sector, CS Fred Matiang'i is receiving a lot of applause for the new changes and the success in how the national exams were administered. Do you think the CS in charge of health should take the blame when it comes to this crisis?
I think many more people should be part of this blame. And I think I want to disagree with Honorable Amaro, my colleague, when he puts the blame squarely on the president.
He's a CEO.
I'm saying squarely on the president. There's something he can do about it, just like many other people in the channel, including our own parliament. We have a role to play in terms of budgeting. But what I'm saying is here is that for us to get out of these things once and for all, we need a sustainable solution. We need working institutions. We don't want all the time to be depending on the head of state for any emergency, be it in hunger, be it in I mean, don't interrupt me, be it in whatever it is. Yeah, I know you don't like Uhuru because of the political persuasion.
No, I like
let's put it that way, because he's I'm not sure.
This is
the way you're putting it, Chris.
But Njogu Barua, when it comes to budgeting, as even as a senator put it, it's a function of the National Assembly.
That's exactly what I'm saying. I'm supporting the senator.
Yes.
We also have a
role to play. You agree that the National Assembly failed to some extent?
I don't agree we failed, but I'm saying we all have a role to play, including the Senate, including the National Assembly, including the President, including the Minister. What you need to do is, can we have all of us doing what you're supposed to do so that we can save the health sector? If you don't work, if the county governments don't perform, however money you give them, something wrong is going to happen.
Yes. Now, I know for a fact that the National Assembly is requesting for a special session to discuss CDF because they've been accused of, quite a number of MPs have been accused of misusing CDF in the previous parliament.
Can I say something before CDF?
I'm giving you an opportunity right now. But now, that has to do with CDF because the National Assembly is currently on recess. But, Senator, do you think the National Assembly should actually ask for a special session to discuss the health crisis?
It should. Let me tell you. Let me support Chris and say this. One, you know, there's Fafema saying about the buck stop somewhere.
Yeah.
This buck is not moving around, around places. The head of state is the head of government. And therefore, the head of state eventually must take blame for either the misdeeds.
The same way they have accepted applause for the success in
It's the same. Yes. It's the same. Or any other cabinet secretary, whether it's security or otherwise. So therefore, the point is this, that when the president is seen moving around and his deputy, promising many other things and other development issues that should naturally continue, when ideally it should be seated somewhere as appearing to be handling the crisis. Because, trust me, the CS has failed. He has waited to call for a meeting on the eve of the strike. It's as if you are calling their bluff. It's a matter of what Chris is talking about. And there's something we are not discussing here. That when somebody dies, when somebody is in hospital, it's a crisis for the country. When that person dies, it's another crisis for this country. Why? Because all these MPs will be called to Harambes. Somebody loses a breadwinner. It's a crisis for this economy to lose a person every day. Because there are many other expenses that are related. But what do we do about it? I've said that we have not prioritized the healthcare. We have ignored it. We have put it in the back burner. We think many other issues, if you look at the priorities in national government, that this is not a priority. And yet it ought to be a priority, healthcare, because we have regarded the healthcare. And this is going to be a crisis that at one point, because when you do a tally of the people who die because of this, there will be no MP, there will be no parastatal chief, there will be no minister who will have to check out of a hospital. Because all of us are covered, we have health insurance, we have health cards, everybody has a health card, and it's business as usual. It doesn't touch on us directly. And that is the reason why we are all seated here having a cup of coffee, and there's no crisis, because it doesn't affect us directly. The minute it pains us that this is about a person who doesn't have the privilege like I do, or my colleagues here, then we are going to start talking.
Yes.
I think one of the critical issues that we should also look at, the issue of the health bill. We've not passed the health bill at the moment because we've also had so many amendments when it goes to the Senate and going to the National Assembly.
Back and forth,
This is a bill that regulates the healthcare. It's like the do's and the don'ts. Everything has to be that healthcare. But one thing I want to propose, which many people might not be happy about, I do believe health care should not have been devolved. I strongly believe we should have had a healthcare service commission so that we have a specific commission that is in charge of the issues of the healthcare sector, the way TSC is. And I know this calls for a referendum. So as we move forward, and I had proposed some of the amendments in the health bill, that maybe we should have like all the referral hospitals, maybe in every county, should maybe be under the national government, whatever it is. Right now, as Senator had initially indicated, you find that the national government is coming in to procure those equipment. And we've had problems with the governors. This is actually the docket that the governors are supposed to oversee. So the question comes, what is the motive of the national government coming in? Already we've been told there's a lot of corruption issues when it comes to, we do not have a hiring policy at the moment. And we've seen big equipments. And that's why you saw many governors were unhappy about it, because they say there must have been a catch somewhere. Why is it that the national government And it's supposed just to be on the issue of policy. Some people have worked under duress to accept these particular equipments. Of course, equipments are important when it comes to diagnosis, everything. But human resource is paramount, because those equipments cannot run on their own without the manpower. And this manpower their welfare must be improved. And that's why I'm focusing around the CBA. So maybe it's the highest time that we must relook at the issue of healthcare and maybe go for a referendum and see that this healthcare, maybe it was devolved when it was prematurely, the counties were not yet ready, and even the national government in terms of policy formulation is failing. We must have a healthcare service commission.
Are you in agreement with Bwana Wamalwa that probably we should reconsider devolving healthcare?
One thing we all agree here, this is a national issue. This is not a party issue. It's not an individual issue. It's a national issue which is serious. I want to agree with Wamalwa and my colleague is that how health services were devolved too soon, without first of all even establish the capacities of the implementers on the ground. If you go at any county today, take it randomly, you not get adequate capacity to do implementation of healthcare facilities, services. But the other point I was saying here is that I was, maybe the center caught me out of context. I was not saying that the president does not have a role to play. But what I was saying is that there is more than that. First of all, there is a systemic failure. It is the fourth president of Kenya. We have had 4 presidents and a prime minister, serious people who would have made their input to ensure that there is progressive improvement of the health services profession in Kenya. The other thing which is said by Chris here, Honorable Chris Wamalwa, is that we need to have, it could have been better if you had a health services authority or commission, whatever it is. And that's what I'm saying. We need to have proper institutions. When teachers go on strike today, before you got the president, you got the teacher service commission, because the issue just exists. So I'm saying you need to have, this game needs to be played by many players: the head of state, the minister, the county governors, and the commission, for us to get a sustainable solution and also get a model that is lasting. If this country, the way it is, our economy is, cannot be able to support Medicare 100% for in a sustainable manner for another maybe 20, 30 years, we need to rethink our model and our strategy.
Do you think the problem would have been different if at all it was just the national government handling the health system?
National government has mishandled this since 1963, and he has mentioned. And let me say this, the part of the devolution that has not worked in the healthcare is the manpower. The purpose Chris is propagating, and I agree to some extent on the health commission, which was what the doctors wanted, was the handling of manpower. You're talking about hiring. How do you hire a doctor in Makueni?
Imagine.
You understand? So who is hiring that doctor in Makueni? The governors have even troublized this issue to the extent that you cannot hire Kikuyu in Makueni and vice versa and things like those. It's a healthcare manpower issue, mismanagement. They've mismanaged. But there's another one. You know, we're in 2016. The population in 10 years is going to increase. What is the policy at national level about training of doctors and sustaining them in this sector? My friend, those are the things we are talking about. The WHO standard says for every 1,000 you have one doctor. 1,000 people. In Kenya, we had 6,200 in 2016. In 10 years, the situation is going to get worse. So what are we saying? This is a crisis. If there was a summit where this country, every time we have an issue, we all of a sudden we all speak from both sides of the mouth, whether it's Jubilee or CORD. But this is about a matter of a nation, where people need to sit down and say, we have failed, and agree we have failed. Exactly. The roadmap is 1 to 10. Look at policy, look at funding, look at manpower. So that the doctors, since they know how to handle this, you can handle it. Nurses, the other day you are training nurses. These nurses are going to work abroad. They are going to South Africa, where they are getting more pay. Because in the end, Ndimuli, doctors work more than we do. We members of parliament, as a sit, and we are paid for sitting. Whether it doesn't matter whether you sit for 5 minutes or 10 minutes. Doctors stand the whole day and they are not paid, work for 14 hours. These people are badly treated. It's that simple.
Yeah, of course, we cannot belabor the point.
Maybe lastly,
final comment.
Also, we want to blame the SRC. The SRC is responsible for the issues of job evaluations. And when you look at the job evaluation, some of the critical issues you're looking at the issue of the skills and the difficult circumstances under which that particular person goes through. So when you look at the issue of doctors, how technical it is, obviously in terms of remuneration, should be higher. You find some clerks somewhere, they're even higher, they're even earning more than paid and more better than the doctors. And when you compare with the WHO standards, we are way below.
Yes.
And my way forward, my advice is, and this is to His Excellency the President, because the buck stops at him, and just like when you read the Bible, in the book of Isaiah, chapter 1, verse 18, the Bible says, Njooni tusemezane. Please,
come, let's
can
talk.
we come reason together to call the doctors, the representatives, the nurses, the ministries, the governors, so that we find a lasting solution?
Yes.
Your Excellency the President, we can't wait anymore. For how long are we going to wait for the Kenyans to die before you call these people maybe to State House for that collective discussion?
Of course, this story continues making headlines. Remember, it's only day 2. Day 2 of the nurses and doctors strike countrywide begins today. Day 1 saw quite a number of deaths. At least 8 people died. 70 other mentally ill patients escaped from the Mathare Mental Hospital here in Nairobi. And you can only wait to see what happens today. Hopefully, there will be a solution, as Bwana Chris Omalo even quoted the Bible. Now, let's move on to another story. And the only other story that probably shares the front page with this story about the health crisis has to do with education. And we can see the photos of the CS for Education, Fred Matiang'i, on both the Daily Nation and the Standard. On the Standard, the headline is, Teacher of Tomorrow to have higher qualifications. The minimum entry requirement for teachers will be raised and their mastery of content emphasized under the new education curriculum reforms. Now, on the Daily Nation, 400 schools face closure, and that's the headline we want to discuss, because that story is also on the back page of the Daily Nation. Let me read a bit. More than 400 private schools face closure over poor learning standards and failure to follow the standard curricula. A report by NAT and Education International, an NGO, called for the closure of Bridge International Academies, among other schools. Now, this has to do with the quality of education. And we saw a few months back when the CS was still very new in the ministry, and that's why he got the title Magufuli, when he raided some of these Bridge Academies and found dilapidated classrooms. Some of them didn't have even amenities, sanitation amenities. Now we're seeing 400 of them will face closure. Bwana Omalwa.
I want to disagree with Magufuli. And Magufuli, in this case, referring to CS Matiang'i. Matiang'i has done well when it comes to the aspects of exams, but he has not done well in the entire education sector. Right now, I can tell you, we still have a shortage of teachers. I had an opportunity to visit one of these schools in my constituency called Bridge International. And by the way, they are doing a wonderful job. In my constituency, as we speak right now, these schools are there, and mostly you find the poor people who are going there. These are schools you find they are labeling themselves green, green, green. I didn't know about it. And when I went there, even the results, they're actually posting more than 400 marks when it comes to the issue of MINSCO. So to me, here he has failed. Because as we speak right now, even in many of the schools that are having government schools, we do not have trained teachers. We are having UT and trained teachers because of the shortage of teachers from the TSC. So the minister here, he's failing. He must have a consultative approach, because I've seen even my constituents, the parents calling me, Mheshimiwa, what is happening? Where are our children going to go when it comes to next year? Because these schools, I've seen them posting very good performance, way ahead of even the public schools. So what we need to know is that we must have this consultative approach. In the first place, these schools are existing because of the minister's regulation, which allowed them to do this. And we should have a law in place that actually legitimizes the existence of this school, maybe in the format of the PPPM. Yes. This is a public-private partnership. Yes. This is something that the government should follow. Because when it comes to performance, I've seen them posting very good results. But those teachers, they are also going through some internal training, because we don't have enough doctors, enough teachers. So it is a responsibility again of the government. when you look at Article 43 of the Constitution, that every Kenyan has a right to education. The Sustainable Development Goals, I think goal number 4, so it says we must access to quality education. Yes. So if at all these schools are coming in to complement what the government is doing, so be it.
Yes.
So we can't close these schools. Where will these children go to?
Yes.
And we don't have enough teachers.
We have to
and already they're providing quality education.
Yeah, we have to admit that even with the free primary education, the advent of free primary education, the schools are still not enough. So when there's an entry like we see with the Bridge International Academies, should the solution be to close them down or really to regulate them as Chris Ombalo is suggesting?
First and foremost, I would like to clear the minister from this blame because to begin with, this is not a report of his ministry. It's a report by the NAT and an NGO. I don't see where the minister is coming in. Number 2, this is another national issue. This another issue we should not argue emotionally. Is an issue we should argue and try to implement it systematically for the benefit of our children and the community. Number 3, C.S. Matiang'i has been there as a minister for education but just about a year. He has not been there for eternity to see that he has failed. And for you to judge that he has failed, he should have really stayed in that office for some time, like they used to have in the previous governments. So I think Matiang'i is doing his bit. In terms of closing the school, I don't fully agree. Because I think as Chris is talking about SDGs, SDG on education is talking about access and quality. So any school or all schools should be assessed on basis of quality. Because existence of the school gives access. Is there quality? That's what we should actually assess. If there's no quality, can you do some improvement to ensure that that quality is actually seen to be there so that you don't actually deny children from poor communities, children who cannot access education from any other institution from going to school. Yes. So I think the issue I have, in my own opinion, for this is not to close. That would not, if I was minister, I would not go by closing. I'd go by assessment and filling the gaps that do exist.
Senator, any thoughts on this?
Yes. A nation that doesn't have a standard is a nation that exists somewhere. You know, this like what they used to call in law, somebody called Hobbes, when he says, when there was no law, life was nasty, brutish, and short. Now, when it comes to, and that's why I disagree with Chris, when you talk about healthcare, you're saying, do not have quack doctors. Make sure that you have the best standards when it comes to healthcare. Why can't we have the same standards on education? So you must have a common standard. Every child who has a right to education in this country must have a common standard. The same way, if you go to a court, we say equal access to justice. You're saying people should not have more than the other. So how do you balance this? You have to balance it by setting a standard. So what is the standard? So although Chris Ombalo is affected because these are his constituents and they are voting for him, other than the fact that they are voting for him, which is an interest for everybody.
I need an opportunity to defend myself.
The fact is that you cannot have and prescribe a different standard. If somebody does not comply, it doesn't comply. Yes. This is not the part where you turn a blind eye. You turn a blind eye because it's convenient. The fact is, seated here, I must be seated here discussing this, both as a person who wants to be elected and a person who also wants quality education for the people who cannot afford. Because we are again talking about the same category of people. We're not talking about people who can afford. We're talking about people who cannot afford. Now, I also disagree with him. And that is why I think Fred Matiang'i is doing well. Education is not about pass mark. This person is trained on many other things other than making sure a person gets an A and gets a B. Because, I mean, surely somebody can... I mean, these days people can even learn on computers and still get that A and still get that B. I've seen students who get A's from in schools that don't even have labs. The fact is that a country must have a standard. What is the standard? You might not agree with the closure, but what is the solution? Do you then tell them, continue, but comply with the standard and give them a deadline? You must mitigate, but you must agree to a standard.
Yes, I want to mention this to Senator. There's something called process mapping. When it comes to process mapping, you look at the inputs and the outputs. If the inputs are of low quality, it goes without saying that the output will also be compromised. But in this case, we are saying when you look at these schools, the output, the only way you can measure performance is through the mean score. Yeah, and if the mean score being posted is positive, like you are getting students, pupils performing more than 400 marks, that explains that the inputs were of quality. That's one. Secondly, these schools, they didn't just come in existence. There are some parameters which were put in place before you exist.
But what do you say to the fact that probably some of the teachers teaching in these schools are not even registered by the Teachers Service Commission?
Now, let me explain. Even in public schools, we have people teaching, and yet they are not registered by the TSC. It is because of the shortage of the teachers we have in this country. And when you go for a P1 training, one of the critical standards is you must have scored a C and above. I took time to go to these schools because when I saw the performance was very good, I want to know what kind of teachers are they. Okay? So when I went there, the teachers who are teaching these pupils, of course, they have a minimum. In fact, we have people who are even graduates. We have people who scored even a B, and the minimum is C before you go for the teachers' training. And I asked them, how do you... They also go through their trainings. They have an internal training which is based on that curriculum when it comes to those training schools. And this issue is coming in because they're coming in to close the gap. To close the gap, we have the shortage of teachers, we have the shortage of schools.
Do you think, as the senator says, they should be subjected to some level of
standards? Of course, standards are there. Yeah. I'm not saying, I don't want you to misinterpret. Yes. I'm not saying that standards must be compromised. No. Yes. No. Standards should not be compromised. And before any school exists, you must have met the minimum threshold before you exist. And as I talked about the process mapping, which I want Senator to understand, the issues of input and output, okay? So if the output, process, you can ask engineers, maybe I can give you some brief lectures. So when you talk about process mapping,
that's what you are saying.
Absolutely.
Yeah.
And the here is this. The year is this, because I went further to probe.
Because you could say the same about exam cheating. Because
just a minute, I'm finished.
Because you get marks
so
to cheating.
The teachers who are teaching, they are of quality. They're not of quality. They are of quality. As I said, some are graduates, and they're working in as UT and trained teachers. Okay? And this is coming in because we don't have enough teachers in this country. So the issue of quality, I've gone there and I've seen the quality is not compromised. They meet the standards in terms of the threshold. And that's why the output, you can be able to see, these children are even joining national schools. But the way forward, what the government should do, what Matiang'i should do, because we must appreciate.
Because the headline here reads, they face closure over standards.
Absolutely. But I'm saying they're not below standards. Yeah. They are of the standards. But the government needs to come in the process of PPP, the private-public partnership, so that they can see how do we improve whatever is existing, maybe through legislation or whatever it is, so that they can continue supplementing, complementing what the government is offering.
Of course, the CS has said that he has put together a team from Quality Assurance in the Kenya Institute of Curriculum to look into the issue. So it has to do with standards. As we wrap up this discussion on education, before we take a short break and come back to discuss politics now that we are privileged to have you here, of course, we know that you engineered the
ranking.
The bill that reintroduced ranking of schools. But last week, Dr. Fred Matiang'i said that this time around there will be no ranking in schools because of some reasons. Do you agree with him?
I think you didn't listen properly. What Matiang'i said, I brought that legislation and it was ascended by His Excellency the President. But before you operationalize a legislation, there's something called regulations. Yes. So they said we passed this, but because of the short time frame, we've not had an opportunity to develop the regulations.
Under the Act.
That's what he said, under the Act. So that caused the delay. But that does not mean he does not agree with whatever it is. But they went also further to provide form of ranking. For instance, there was that issue of MINSCO when it comes to the counties. Yeah. So at least you can see how the counties are doing.
Number 3.
Yeah,
was
number 3. So that kind of ranking is there. At least we can be able to see how they are doing.
So the issue,
absolutely, when the regulations come in, but already we've seen some form of ranking. It's already taken off, my dear.
Okay, let's take a break and enjoy some music. When we return, right here on our news review, we'll be discussing the headline about ODM kicking out 10 of its members. Is it possible to have by-elections before the next elections? That question. Of course, Governor Mutua and Governor Alfred Mutua of Machakos and Wiper Party leader Kalonzo Musyoka with regard to whatever allegations the governor made. Does it amount to political suicide for the governor? We'll be discussing that and a lot more when Power Breakfast returns.